In this episode of the To Your Health series, we welcome back Dr. John Hogg, who tells us all about spider veins, how to prevent them, why you need to treat them sooner than later, and the latest fashion trend, compression socks. Welcome to the San Antonio Woman Podcast, sponsored by Partners Real Estate. I'm Katie Goodman, your host, and this is the To Your Health podcast series. Today I've got Dr. John Hogg. Thank you so much for coming back on. You were our honorary first-time guest in that last episode, and we've got you back today.
Thank you. I had a blast doing it. And thank you for allowing me to be able to share some medical information to patients.
Yeah, and you've really shared so much between the contribution you give us in the magazine. We had some serious drops of wisdom in that last podcast, all kinds of women's health issues. It's about pelvic pain, how it's related to veins and vein issues.
It
so
certainly is.
We learned a lot there.
Thank you.
Yeah, and before we get into the next thing, I still want to bring up a little bit of your background,
Yes,
give
ma'am.
you your flowers, because you've done so much and you're really one of those doctors that stands out off the page between, the research that you've done over the years. You've been in it for a good chunk of time as
Yes, ma'am.
well.
Uh-huh.
So how long have you been in the business? And
I've been in private practice 32, 33 years.
okay.
And again, I'm just not quite 40, but started young.
Yeah, no, that's the way to go, man. And you know so much, you care so much, which is, I think, probably the biggest thing that people pick up on from what I've heard when they come to your clinic. You make people feel seen and heard. That's so important in a world where it feels like sometimes doctors are herding cattle at times, in and out, and so that makes a difference.
It does. And that's one thing I was seeing, and we see it more and more. There's more and more corporate buyout of medicine. And who would have figured that, medicine where you're caring for people, it becomes, this corporate machine, and how much can we squeeze out of that and spend less time with the patient? I thought, that's not what I want to do.
Yeah.
Why I am in it, I love helping patients, and I love it when we discover something that's going to help them. That when the lights come on and that patient's like, oh my gosh, this is great. That's makes all the difference. And when the patient comes back and they made chicken and dumplings or sweet potato pie, and they bring it in there because they're so happy that their legs are feeling better. I mean, that's what keeps me going.
That's how you know you did something right, is when you get sweet potato pie.
Oh,
I
I'm
want
telling
sweet
you.
potato pie. I'm gonna have to start taking some notes from you.
Yes.
But you don't. It's cool because I was kind of looking through your resume, so to speak. I see you're Baylor Bear. You went to Emory University, Southern Methodist University. So you have so much credentialing. You have so many letters after your title that it looks like a whole nother language. It would be a whole podcast episode just to break down each one of those. But not only are you a doctor, you have a business degree in finance and accounting. That's wild. Like, you are so educated.
Well, thank you.
Yeah.
Part of it, when I went through school, I majored in accounting finance, and I loved it, as far as I could work the problems. It was math, and it came natural to me. And they said, oh, you have a great job. I liked it. And I got out there and I thought, this is not cut for me. I want to be helping people. I don't want people to resent me to come in as an auditor. And so I had friends in medical school, and I started volunteering at Parkland Hospital. And it was crazy fun. They put me in the ICU, and I would go in twice a week, and I would just, the patients, or most of them were unconscious or intubated, and I would bathe them as they were in their bed, sponge bath, and weigh them, which is important. They could tell how much fluid was coming in or out of the body. But I felt so good about it, getting them prepped and cleaned up so that their family could come and see them. And so I knew that's what I wanted to do.
That's incredible, and to have the, I guess, drive to make the change as well. I think a lot of people, they get stuck in their path and they think, oh, I'll just stay here and see it out. But you were like, nope, this is the direction we're going to go.
And I strongly believe that, there's something you're passionate about, you're going to do great at it, but you really want to do what you're passionate, what you love, and then you're going to do well.
Yeah, well, it looks like you have. I mean, you've got 2 locations going. I mean, your media coverage is all over Texas, Austin, San Antonio. You did a thing on President Trump's vein problems as well. So that's really cool.
And that really hit home. He had these swollen legs that everyone ignored. Here it is, one of the most important people in the world, and every single eye, they watch everything that he eats or does. And yet he has these huge swollen legs and everybody's ignoring it. Like,
Yeah.
oh my gosh, that is lymphedema. He's had vein disease going on a long time,
Yeah.
which is the number one cause of the swollen legs or lymphedema. And
Yeah.
he was undiagnosed. And thank goodness he didn't have blood clots or some
Yeah.
worse complications. But it's
Yeah.
something, that it just shows that in everyday Americans, it's something that's ignored, that's
Yeah.
not detected. And so my mission is to get out there and tell them about it and y'all
Yeah.
stop it before it gets worse.
Do you think that sometimes it's kind of a culture to ignore the more subtle signs?
Absolutely, it is. You're gonna know that cough, that's new, or the sore throat, or you have a headache, or you fell and hurt your. Those are acute things and they're important, but you recognize them. Things that are very subtle. And of course, also, we have to watch blood sugar and high blood pressure, and those things are often silent, but most providers are attuned to that and checking for that. They're not looking at your legs.
Yeah.
Well, what's your transportation? Those are your legs. You got to keep them going. And when they're going, everything in your body's doing better.
Oh, that's so true. Because you see it in older people when they start to settle down, they're more
Hmm.
sedentary and they sit more. That's when all the problems kind of start to come
It
out,
is.
right?
And in fact, I had one lady that came into the clinic and my manager came up to me and she says, this patient's here and she wants to see you, but she doesn't have an appointment. I said, that's fine. Let me go see her. So I went to go visit with her and she was just grinning like a possum. And I said, how are you doing? And she said, oh, I'm great. I just came from my cardiologist and they did my heart echo and they said, it's the best it's ever been. I said, that's great. She said, and he wants to know what pill I'm taking. And she just laughed, she just roared, and I thought and then she says, "And 2 weeks ago, I had been to my endocrinologist, and my diabetes is under control. I have the best A1C numbers, and they've cut me back, and I'm just taking the metformin, not the insulin anymore." She said, "It's amazing." And he wanted to know what pill I'm taking. And I was thinking, "Hmm." And then she goes on to say, on it about different things, and I said, "Well, what pill are you taking? I need to take it." And she laughed. She said, well, Dr. Hogg, I'm not taking any pill. She said, you fixed those bad veins in my legs that were holding me down, weighing me down. And she says, you fixed them about 4 months ago, and I've lost 45 pounds. And she says, they don't hurt to walk. I'm walking more. And she said, everything in my whole body is better. My blood pressure, my diabetes, my heart, everything. She said, and it's great. She just gave me a big hug and she left.
Wow.
So
See?
that's
That's
what I'm talking about.
insane.
These legs are really key to your health, so you don't
Yeah.
want to ignore them.
Life changing.
It
Life
really
changing
can
enough
be.
for a 9-year-old woman to come into the office and say
Yes,
thank you. Just thank you.
exactly.
I love older people because
Oh,
they don't care
they
anymore
don't
and
hold
they're so
back.
cool.
There are no filters. They're going to
Yeah.
tell you. So
Yeah.
it is really refreshing. I
Yeah.
love that.
Yeah. Great feedback, I'm
Mhm.
sure. So, just well, before we get into the topic, I have to bring up you've also been on a ton of committees, boards. You even were a co-founder of
Barkingham
Bark
Village.
and Hill Village
Yeah.
for animals. So it's not just so the love and care you have is not just for people, it extends to animals too.
I love it. My animals and plants both. But
Yes,
yes.
yeah, use your lemon trees.
Oh,
You
yeah.
have your lemon trees. Last episode we get into that if you want to
Oh,
look.
yeah. You
Yeah.
have to go check out the
Yeah.
lemons. But yeah, dogs, I love them. And they're, thank goodness society has evolved and they're really little humans, what we think about them. Those are our kids and you want them to have the best of care. And so many years ago, there wasn't a choice having pet resorts and things like that. It was not there. And so, you had to take your dog and drop them off at the vet. And, it's kind of like dropping your kids off at the hospital and they're hearing
Yeah.
screaming and crying like the barking and
Yeah.
and they could sense it was and so it was not a pleasant time for them. So I just realized I wanted to have something, where they could go and be relaxed and be happy. And so we started the first doggy daycare in the country. And they had us on Oprah and Wall Street and all these magazines and stuff. And we opened them across Georgia and then Texas. Yeah.
Wow, so
So
it was big.
yeah.
Whoa.
So
Oh,
yeah,
that's so
Barkingham
cool.
Village is still out there.
Oh,
So yeah.
wow. Well, good for you. That's
Thank you.
amazing. And your dogs hit the jackpot because they found not only someone who's like a doctor, great salary, but as someone who just went through some dog problems myself
Mm.
and not knowing the medical side of things. I actually had a friend who was a doctor who picked up on some of her blood work and said, "Hey, maybe you
Okay.
should check this and this and tell your vet that." And
Well,
so
it's important.
I'm sure I mean, they hit the gold jackpot,
They
man.
did,
Yeah.
and sometimes I get the floor when they push me out of the bed.
Yeah, well, it's always anything for the dogs, right?
That's right.
Whatever the dogs need. But yeah, that's really cool that, I think it speaks a lot to who you are as a person, your heart. And I think, I mean, people can see it anyway when they are
Well, thank
in
you.
your care. But yeah, so I just wanted to bring that up. But before we go any further, a lot of the things that you treat are obviously vein focused. As a woman, some of the things that I think of first when I hear of a vein clinic, I think varicose veins.
Absolutely, and that's what the most common thing I see is I've got these little spider veins, and they see them, and that's what bothers them. And so we come in, and I talk about, what causes those. I said, "Don't we want to know?" And they said, "Well, yes." And so I said, "Well, it's a process. We look to see which bigger vein underneath they don't see that's not moving the old blood out. It gets big and tight."
Mm.
And I kind of explain it a little bit like if you had a tree and it started getting bigger, that pressure goes into the branch and goes over here where the leaves are the little twigs, and that's what they blow out and see the spider vein. So you always want to think about if you're seeing those cropping up, it's a warning sign because you want to find out what's going on underneath, which can be dangerous, can be more life-changing long term and not in a good way.
So many people think of them from a cosmetic
Hmm.
perspective. I'll never forget, even from a young age, I remember Tina Turner talking about her legs, and I think it was an Oprah interview,
Oh
and
yeah.
Oprah was like, "How are your legs so amazing? Like you have these stunning legs and no veins." And she said, "Don't cross your legs." And here I am crossing my legs. But, is that a true thing or is that a myth or
Well, I think temporarily, but people aren't that cross for that long. But the biggest thing as you're crossing sitting here is not having the leg movement. We have to remember
oh,
how is the blood
as I
supposed to
shift my
return.
legs?
So here we go. So
Yeah.
I do these calf pumps a lot, and I teach
Okay.
patients about that. If they're
Yeah.
working,
Calf
we
pumps.
have a lot of people in the service industry in town, and so they're on the computers, on the phones, different things, and so we want to keep our legs moving because that's how we return the blood to the heart when we're not horizontal, is by moving our legs. And right down here, your calf pump,
Uh-huh.
that's your heart that's pumping it uphill. So that's half
Oh.
of it. The other thing, you have to keep it from falling back downhill. And those are these little one-way valves. Somewhat, we call them check valves in plumbing. And they're every few inches up your leg. And so if they're working and you're moving your legs, you're not having problems. But the problem is these get stretched out over and over and over from not moving our legs, a lot of factors. And then when
Mm.
they stretch out, they can't hold the blood up and it keeps falling down. And so then at the end of the day, you're like, my legs are kind of swollen. These socks,
Yeah.
or shoes are tight.
Yeah.
That's not a normal thing. So
Oh.
people think, well, they did it yesterday and the day before, it's normal. It is not, and it progresses. In
Wow.
fact, when you see someone that has the chronically swollen legs,
Mhm.
the number one cause in this country is untreated vein disease that causes it.
Wow.
Whereas in third world countries, it's parasites stopping up the veins. But here it's just simply because we sit or stand a lot for work, traveling
Wow.
cars.
Yeah.
And interestingly enough, our top two professions that we see, one is teachers,
Oh.
and second is medical people. So
What?
that's probably two-thirds of every patient I see. We sit a lot grading papers, watching a classroom, or watching the buses, or we're standing in an OR or sitting charting, but we're taking care of people or teaching them, but forgetting to take care of our legs. So let's keep
The
them
most
moving.
simple things can
Yeah,
cause the biggest problems
sure.
is what my takeaway is from this. People talk a lot about stress and other things like that and how that can affect, your heart or circulation or circulatory system.
Sure.
Does that really apply here, or is it more that just the sedentary nature, the not moving?
The biggest thing for the legs is going to be that not moving.
Okay.
There are other factors too. If one is larger, it's pushing against more pressure, so it's easier for that vein to stretch out, just like blowing up a balloon. And they
Hmm.
stretch out and lose their elasticity. When you have babies, that's a big thing with women. So that's why we do see more women.
Mm,
Everything when you have a baby, these stretch out. Well, you want to, if you're going to do that, wear the maternity 2030. That's the strength compression stockings, the medical grade ones, at
okay.
least your last 6 months, and it'll save a lot of your legs, keep that from happening.
Wow.
Yeah. And,
Wow.
and tall people, I've got a little bit of that going on at 6'7".
Yeah.
As
Yeah.
they say, I'm a
You're
deep
giant.
swimming pool when I stand up. So I have
Yeah.
a lot of pressure down here near the drain. So it's
Right.
more hydrostatic pressure. So I'm more prone to them stretching out. And that's why I wear my
You
compression
you wear
stockings
your
every
compression
day.
socks.
I do.
So should I start wearing compression
I
socks? I'm
would
in my mid
recommend it. I think
30s.
it's great.
Okay.
And if you have some special event you don't want to, then fine. But I think it's important
I
that,
could style those.
yeah,
Okay.
you
Give me
can.
the
I'm
challenge.
telling you, you can do it. You can work it. You can wear
Yeah,
anything,
yeah,
Katie.
I'll give it a go. I'll give anything a try
You
at this
do it.
point. If you wear it with enough confidence, maybe
There
it
you
can
go.
become a trend. Me and you
Exactly.
will get it going.
There you go.
That's funny. But yeah, so really anybody could start wearing it as a preventative
Yes.
measure. And is there anything else aside from walking that can kind of help prevent, I guess, the varicose veins? And it's not
Well,
just women, right? It's men
men
too.
too, exactly. The most common cause is heredity. So, if
Mm.
you like your grandpa's legs or your grandma's legs, if you're not liking them, you better pay
Oh,
attention because
okay.
you're headed genetically down that pathway.
Oh,
So they do tend to
wow.
wear out by genetics.
All
And then the
right.
other things, keeping your legs moving, controlling weight as much as possible.
Mm.
Um, those things help.
Yeah, yeah, absolutely. When it comes to fixing,
Hmm.
quote unquote, fixing your varicose veins, you had mentioned it's not just about what they look like, it's about getting back healthy again. But what is the process for that? Are there different levels? Is it the same treatment despite how big or prevalent they are?
Good question, Katie. It's actually different for every patient, and we individualize it because it's just like my palm print. It's going to be different than yours.
Yeah.
And some veins are big or bulgy or close to the skin or they have a tortuous course. So it all depends on the method. But the one universal thing about vein treatments today is they're non-surgical. So we don't go in and cut them or pull them out or no surgical thing. That's very much an antiquated procedure with a lot of complications. And so we leave the veins simply where they are and we get them to dry up. Different
Okay.
techniques, but you're wide awake. You walk in, walk out, and go back to work.
Wow. Okay. So it's not super painful after, or could it be?
No, I mean, you may have some achiness occasionally.
Hmm.
We use ice, which is really the best thing if you have some soreness. It's a good anti-inflammatory, but no, we don't use any general anesthesia. That's why you can walk in, walk out. And it's just like going and getting your vaccination or your antibiotic shot.
Yeah.
You might feel a shot, but
Okay.
it's short and quick.
Okay, and if you're younger and you're starting to just see tiny little hairline stuff pop up, what's the move there? What do you
The
need to start
move
doing?
is to get checked out and
Okay.
find out, because do you really want to wait until one of the more common things I see, the least common symptom that we see is pain. We don't often see that, but I'll see swelling. I'll see this dark discoloration around the inside of the ankle, which is iron left over from red blood cells that die in your leg because they cannot get back up to get oxygen. The veins aren't working. So we see lots of things happening in the leg. But if you start early, oh my gosh, you want to at least follow it and see if you're at the stage you're ready to be treated, but you want to know. You don't want to wait until you have more complicated problems.
That makes sense. Beat it while you're doing better,
Exactly.
right? Don't wait till the last minute.
And one thing too is the insurance companies recognize that untreated vein disease is going to be a problem down the road. They know
Yeah.
this statistically, and it's going to be very expensive. It may be that you have cellulitis, that red swollen leg with infection. You have to go to the hospital and have IV antibiotics for a few days, and you have a $60,000 bill, or you're in there for weeks and it's in the hundreds, or maybe the skin dies. You have a little scratch that turns into a wound that won't heal, or you get blood clots and all these horrible things that are expensive. So the insurance companies realize if you're starting to have the problem and your veins aren't working, let's get it treated so that you're going to be healthier and we don't have to pay for all those complications.
All right, so it's good to be ahead of the curve. And
Sure.
now, this next question, it might be adjacent or a little bit off topic from this, but
Okay.
how is restless leg syndrome kind of, is there any association there with
Absolutely.
with this?
It is about, it's interesting that patients that have been treated, and it may have been other things, they didn't really bring that to attention, but it's about 60% of those patients treated for vein disease, the restless leg was also cured, and it wasn't even a presenting symptom. So it's not totally from that. You can also have it from nerve type initiated problems, other things, but it is amazing. In fact, I had one provider, this doctor, and I was talking to him, and part of my duty is to educate. And I want to educate your followers, and I want to educate providers too, so that they can help their patients. But I was talking to him about restless leg, and he says, well, my wife has restless leg. And I said, really? And I asked a few questions. He said, yeah. He said, she's had it for years now. He said, I tried her on the rot, and he names all these drugs, and it didn't seem to get any better. In fact, we have to have separate beds now, because she's up all night.
Oh, it's awful.
And it just, really impacted their relationship. I said, send her over. Let's look. Sure enough, she had extensive venous insufficiency. So I said, I don't know if that's the cause, but I tell you how we find out. If you get the medical grade 20-30 compression stockings and you wear them from first thing in the morning until last thing when you go to bed at night, by that if you do that for 6 days, by the 7th day, I want to know, did it get better? And sure enough, hers went away.
Oh my
and I said, you wear it
gosh.
another week. And it didn't come back. And so we treated her veins, and boom, it was gone. So it is wonderful when you make those things. And this is, her husband loves her like crazy. And yet it's something that he didn't know what to do to fix it. And it's not uncommon because, that's why we're all specialists in different areas. And I want to go share my knowledge.
Yeah, and it's interesting how it was something so simple, like it wasn't a bunch of medication or all it's just the socks.
It's a mechanical problem.
Yeah, wow. And from what I hear, there's a tie between restless leg syndrome and menopause, right? Or is there more? How does menopause change things for women who are experiencing, whether it's spider veins or any vein issues?
With the menopause, you've had, usually the vein problems have built up over time, and they can be a little worse, during the menstruation. And at menopause, your hormones are changing. So, with that, a lot of times you're doing supplemental hormones, and it's very important that, you're monitoring that is correct, but also realize I'm helping the symptoms, of menopause, but I'm also putting myself at a little higher risk for blood clots. Exogenous hormone therapy is associated with increased blood clots. I see it routinely. More in men. They're starting to take these hormones when they're 10 years old. No, not really. But, but I see the guys, at my gym, everybody's on them but me. But they're like, and sure enough, half a dozen of them get blood clots. So you have to be careful. I don't see it quite as much in women, thank goodness, but we do have that also. So, when somebody's had blood clots, they'll usually have them stop their hormone therapy. But just monitor it, stay hydrated, wear compression stockings when you can.
Yeah.
And
Okay.
talk to your doctor about it.
I mean, there's so much, I think a lot of women don't know while taking a lot of this hormone therapy. They think, oh, I just want these symptoms to be relieved.
Yeah.
And they might say, oh, here's a whole list of side effects, but it's until you start really getting the side effects that you realize how bad those can be.
And it can be very beneficial. And I'm not, an endocrinologist or an OBGYN, and certainly they want to have your conversation with them about that. But just be aware, whenever you're doing hormones, birth control pills, not even at menopause. I see patients birth control pills and they're 22 years old and come in blood clots. And so it is just one of the factors that increase risk for clotting. So you have to take extra precaution, certainly wearing thigh-high compression stockings when you're traveling. If you're sitting, keep these calf pump going and stay hydrated, but just be aware of the risk factors and try to mitigate it if you need to be taking them.
While on the topic of blood clots, what are some of the key signs that you might have a blood clot? I know sometimes it's too late. You're like, blood clot. But, what are some of the key signs that it's starting to happen or it's about to become urgent?
Yes. Well, anytime your leg, and usually blood clots are going to involve one leg. So that's kind of a clue.
Okay.
So this one leg starts to get swollen, and usually it's not going to be swollen just in the thigh. It starts because it's backing up the blood, so it's going to be down all the way, you know, in the foot, but it usually starts lower and comes up. But anytime you're having a red swollen leg, you need to have that looked at.
Yeah.
You know, if you can palpate, they say, a palpable cord, suddenly you feel like there's a hard rope in there, and that's a concern. But most of the time it's pain, and it's swollen and red.
Wow. Wow. Well, I mean, I feel like you're just a plethora of knowledge. There are so many topics we could get to and talk about. That's why we have another episode
That's right.
coming. It'll be dropping
Well,
soon in
thank you for
February.
allowing me to share,
Yeah.
you know, what little knowledge I have.
Oh, please. I mean, I think you've topped the charts on knowledge. We saw those letters behind your name, so
well,
that's amazing.
you're
But you're
very
so
kind.
humble about it, and we really appreciate that and,
Well,
your
it's just-
time.
Well, thank you. It's just fun to reach out and be able to talk to all your followers and, you know, think about, you know, how that applies to you and how you can help your friends, your mother, your daughter.
Yeah, it's super educational because as we're talking about this, I'm already thinking of things that I've seen in my own family members too. That I'm gonna have to send them to you. But you know, you also have a YouTube channel, so
Sure.
that's where you can learn some stuff. You can
Yeah.
check out their social media. They have all the handles on every single
Yes.
platform. I've already looked it up, Medical
That's right.
Vein Clinic.
Yes.
And then if you want to look up, you know, get in contact with Dr. Hogg or make an appointment at any of the clinics, yeah, just go to medicalveinclinic.com.
And whenever you're seeking medical, you know, advice, always seek the best. It doesn't matter if it's your bones or, you know, your OBGYN, but, you know, find out who really is the best in that area because you deserve it.
Yeah, absolutely you do. Thank you so much, Dr.
Thank
Hogg.
you.
And we'll see you again next time.
Thank you. My pleasure. Thank you.